What really got me to invest a lot of time into flourishing or connecting a physician well-being, if you will, is my own challenges that I had early on in my career, wanting to take care of everyone and really be the best physician I could and the best researcher I could and the best mother I could, and everything in all aspects of life led me to have some serious difficulties with burnout. The realization that we were all living with this in silence made me want to embrace this, essentially, talk about it, destigmatize it, and see how I could play a role to help other people maybe go through this journey a little quicker than I did and not have to suffer as much in isolation.
Welcome to Flourishing in Medicine from Surviving to Thriving. I'm your host, Dr. Michael Krasner, and this podcast is produced by EmPro, a medical professional liability insurance carrier headquartered in New York State. We're committed at EmPro through a number of peer support offerings to support the physicians that we protect. In this thoughtful and deeply personal conversation, Dr. Catherine Pound, Director of Physician Support and Wellness Services at the Canadian Medical Protective Association, CMPA, reflects on her journey from clinical pediatrics and public health into physician well-being. She shares how her own experience with burnout led to her to recognize the widespread silent suffering among her colleagues. Rooted in her lifelong values of compassion, connection, and curiosity, and the desire to serve, she now champions a systems-level approach to help healthcare professionals thrive, not just survive. Through her work at CMPA, Dr. Pound has helped build innovative programs, including peer support, longitudinal coaching, a national well-being index assessment, using tools to help assess the well-being of physicians. She highlights for us how connection, trust, and psychological safety are foundational to both the clinician and healthcare system, where support, collaboration, and compassion are the norm. This inspiring episode is a testament to how personal challenges that she's gone through catalyze meaningful change across an entire profession. And now, enjoy my conversation with Dr. Catherine Pound. Catherine, it's really wonderful to meet you again and to have this conversation with you.
Well, thank you so much, Mick, for having me. It's really nice to be here with you today.
I want to start with a question, and it's a question many of us are posed and answer sometimes pretty easily, but I want to go a little bit deeper. The question is really, why medicine for you personally? But I want to move beyond the biography. What I mean by that, although it's interesting, the chronological step-by-step kind of instrumental progression of how you got here, I really want to hear a little bit more about you, your values, your qualities, what it is about you that drew you to a career in medicine.
I didn't always know I wanted to do medicine, but I figured it out pretty early, I would say in my late teens, where, I grew up in an environment where there were a lot of people who were healthcare workers, so I think that probably had an impact on me. But I think it's the combination of having the opportunity to care for people, but in a way that you don't really get to do anywhere else. You really have to develop these connections, these very deeply trusting relationships with the people you're working with. And I worked as a pediatrician for many, many years. And for me, it was really, I think it was those deep connections that I found fascinating, and having the trust of parents to take care of the most precious thing that they have in their life. And I love the puzzle. I love figuring things out and trying to understand what's going on, and the challenge and the ability to do a million things, right? It's not just about treating the patient, which is of course something I love, but also teaching other people, mentoring other people, doing research. There was so much of it that I knew I wouldn't get bored, and I love it.
And so I'm wondering if you could just go just a tiny bit deeper into what was it about you that really, that those things were so important, that connection, that in your life experience when you made decisions to kind of move in this direction and really make quite a commitment, because as we know, it's quite a commitment to undergo the educational programs that we had to do to get here in our profession. What was underneath connection, challenge, curiosity? Was there something about your family? Was there something about something you really longed for? Was there something reinforced by other experiences?
I've often asked myself that actually, and I don't think I could have answered that a while ago, while why connection was so important for me. It always has been. We all have challenges, so I guess I can go back and try and figure out if a particular challenge got me to want to really connect with people. But I think what I've uncovered, I think later on, is that connection and trust really allows you to develop or to give compassion to other people. And compassion, we talk often about compassion and empathy, and I think those two are actually quite different. But compassion is so rewarding. It's so soul-filling. And I think I realized early on, without knowing that it was called compassion, that feeling that when you're helping, when you're caring deeply for someone, and when you're helping them, it's energizing. It feels good not only for the other people, but for you yourself as the provider, the healthcare provider. And it's true in healthcare, but it's true everywhere. As for the curiosity, I think that's something that was cultivated in me since I was very little, but also something that I always had. I've always been involved in a million things, and I always want to learn something new. I thrive on that. I get excited by new challenges, and that's something that there's no shortage of in medicine, puzzles and things to be curious about. And the same with the challenges.
I resonate with everything that you said. I'm thinking about how you brought compassion into the conversation. And, as social creatures, we must connect. I mean, our survival really depends on it as human beings. And evolution has designed us, as you know, in such a way that when we enact compassion, when we care for the suffering of someone else and then actually take an action to do something about it, it's immensely rewarding physiologically. And then to be able to make a career out of that is kind of doubly rewarding, that you could actually do this and make it a way of livelihood to support your family and your community. So wonderful, wonderful. If you could, I'm wondering if you could walk us through a little bit about the events, decisions, experiences that led to the work you're doing now with the CMPA, and really thinking about that in terms of flourishing, the work you're doing, as I would describe it, to help people flourish, especially health professionals.
Sure. Well, now we're going to get a little bit more personal, I think, with that question. For me, what really got me to invest a lot of time into flourishing or connecting a physician well-being, if you will, is my own challenges that I had early on in my career. We talked about how I love challenges and curiosity and those values that are so important to me, but there was a part of me that really wanted to excel at everything. I think a lot of us are like that. And, this desire to always do more, well, you can see where that leads pretty quickly. The saying yes to everything and going very deep into everything I was involved in very quickly became not sustainable. And this wanting to take care of everyone and really be the best physician I could and the best researcher I could and the best mother I could and everything in all aspects of life led me to have some serious difficulties with burnout. And it was interesting at the time. I really felt like I was the only one going through this in the world or in the world of medicine anyways. And when I came back after a little bit of a break, many people came to me and whispered that they had the same challenges, but they hadn't talked about it. And it hit me that it was such an important topic. People weren't talking about it. And that was probably 10, 15 years ago now. The realization that we were all living with this in silence made me want to embrace this, essentially, talk about it, destigmatize it, and see how I could change the system. And now this sounds really big, so that I could change the system so that everybody could flourish. I'm going to bring this down a little bit, but to see what my part would be in this, how I could play a role to help other people maybe go through this journey a little quicker than I did and not have to suffer as much in isolation.
Yeah, along the way in this journey, as I understand it, and you can correct me or give us the chronology if it's needed at all, is you moved from clinical pediatrics and at least brought public health into your training and then into your work life. You're immensely accomplished researcher, and you've published lots of things having to do with pretty significant public health issues in the domain of pediatric health. So tell us a little bit about how that connects with your why and how that was one of the sort of stepping stones to where you are now.
I think the public health aspect for me is the preventative part, right? And in pediatrics, a lot of what we do is prevent diseases, right? Vaccines, preventative medicine, all the things that many of the things we do in pediatrics and in other parts of medicine as well, but at least in the area of pediatrics, was really trying to keep people healthy before things happen. And that's where my research went, right? That's what I was interested in, is how can I prevent people? How can I keep people healthy as opposed to having to fix the problem later? And that was the same thing with this, right? So I experienced challenges. I saw people around me and I thought, okay, great. I can heal myself, but how can I prevent this for me and for other people? How can we be healthier before the problem happens, and how we can change things around us so that we do flourish, that we do grow in this field of medicine so that we can actually really help the people we care for. How do we care for ourselves?
You know, we could say, even you describe your own burnout, and then to discover you're not alone, and to discover how actually really prevalent it is among our colleagues, we could say that burnout, because of the connection between our well-being as health professionals and quality of care, which is clearly a strong connection and undeniable, that it is a public health crisis. You maybe can comment on that, on the connection between well-being of the professionals and our ability to improve the health of our communities.
I 100% agree with what you said. It is a public health crisis. Physician well-being or healthcare worker well-being, for me, is a pillar of a healthy healthcare system. We know, it's very clear that physicians who are not well, A, they leave the profession. We have a health human resource crisis here in Canada. I know you have similar issues in the US as well. So people leave, and that makes the health human resource crisis worse. And for the people who stay, well, it puts more of a burden on them. And also, when we're unwell and we stay in the profession, we know the studies are there. There's more instances of patient safety incidents. There are more instances of professionalism issues. It's very difficult to care for people when you're not well yourself. So if we want our people to be healthy, we need our healers to be healthy as well.
So in one way or another, your background and then this public health sort of realization, or just it's part of how you look at things, led you to this CMPA as the director of physician support and wellness services there, member experience. Can you tell us about the CMPA a little bit, about why you joined them, and maybe first about the organization, and then why you wound up there in that position of leadership?
Right. So the CMPA is a mutual defense organization. So it's an organization that is run by physicians and non-physicians as well, but for physicians. So essentially, we provide medical legal assistance for physicians who practice medicine in Canada. So the CMPA is really interesting in the sense that it does a lot more than provide medical legal advice and provide medical legal assistance. I mean, it does do that. Obviously, that's the reason why we are who we are. But we also do a lot of other things. We do medical education, we do research, and we do physician well-being. And actually, when I joined the organization, I joined in the medical education department, did some medical education and research, dipped my toes a little bit in the medical legal world, and absolutely loved everything I was doing. But there was this physician support and wellness department that was very new, that was starting out at about the same time I joined. That was my passion. That was where my heart was. And there was an opportunity to continue growing the department and to put my personal touch on it and to work with an absolutely fabulous team. So I jumped at the opportunity. And for the last 2 years, I've just had the most wonderful time trying to make a difference and impact well-being in our colleagues.
One of the things I really hope for our listeners and viewers is that they get inspired on a number of levels. One is that they can begin to realize they actually can be agents of change and growth and improving professional lives for themselves and for their colleagues. And so it's really interesting to hear how someone in this leadership position thinks about this and has developed into that. Can you speak about how you, as a director of physician support and wellness services for your members, how do you think about ways to develop support for the physicians you serve?
Mhm. Thank you. That's a really good question. I think the first thing I would say is that we take our cues from our members. We listen to our members. We listen to their needs, to what they're asking for. And we also use the data that we have. We have a lot of data that is available to us from the literature, also some data that we collect at CMPA when people call. And based on that, we develop programs that will offer support to our physicians that have well-being issues in relation to medical legal events. And I can talk to you a little bit about what we're offering right now or some of the programs we developed. So one of the things that was really important for me was to have solid data on physician well-being across the country. We know from talking to our members that they're not well. We know from various studies of various departments that there are difficulties, but we don't have great national data on physician well-being in Canada. The only thing we have at this point that is national is from a survey that was done in 2021 by the Canadian Medical Association, and the response rate was about 3 to 4%. So it's low, and it's hard to know how representative it is. It was concerning, showed very high rates of burnout, depression, anxiety, but it's starting to be a little bit old in terms of data. And from our perspective, the CMPA is so uniquely positioned because we are a national organization that has a lot of members. We have upwards of 117,000 members. So we partnered with the Physician Wellbeing Index team that was created by researchers at the Mayo Clinic and customized it to our organization, to the Canadian context, translated it to French as well, because we have a big French population in Canada, and administered it to all of our members. The beauty of this tool for me is that it is a data collection tool, but it also pushes resources that are curated for the member, specific to their province and territory, and also can change if they are in crisis or not. Anyway, so we have implemented this recently and are hoping then to get the data that we need to really identify where our members' needs are, essentially. Not only what physician well-being is across the country and in all provinces and territories, but also are there groups that are struggling more? And why that's important to us? Well, A, because we want our members to be well, but also because we know of the association with patient safety and physician well-being. So that's one of the things we're doing. Another one of our program is a wellness support program, which is a peer-to-peer support that we offer to physicians that are struggling a little more than their peers when they're undergoing medical legal events. And the beauty of this program is it is an extension of the medical legal services that we provide. So there's that confidentiality aspect that you may not find as much in other programs. And it's a very new program. We don't have a lot of data, but what we are seeing so far anecdotally is physicians telling us that because of this program, they stayed in practice or they returned to practice earlier than they would have. And that to me is incredible success, because if we can keep a couple of physicians in practice over a couple of months, the number of patients that are impacted by this is huge. Another program we have is a program where we offer longitudinal support to our members who find themselves undergoing medical legal events at a maybe higher frequency than their peers. And of course, we know of the impact of medical legal events on physician well-being, right? It's well known that it decreases well-being, may even increase suicidal ideation. Those are difficult times when we undergo medical legal events. And this program really supports the member in a longitudinal way and looks at the whole being and provides well-being support, coaching, all sorts of tools that helps the member really assess their situation and improve their practice. And in fact, we have data to show that this program is incredibly helpful in terms of supporting well-being, but also decreasing college complaints or regulatory body complaints by about 55 to 60%.
Well, those are wonderful set of programs, and clearly featuring peer support in the way that you're featuring and growing it, I think is will have a big payoff. Already sounds like it's had a big payoff. It's been our experience as well, and experience with a lot of the folks we have on this program as well. So all support to you. That's wonderful. I was looking at a number of the other programs. I just wanted to mention, especially for our viewers, and we'll include some of this in the show notes, that you have workshops, you've got a podcast, you've got these wellness support that you described, you've got things on professionalism and ethics. There was one thing that I found, I think it was in your surgical safety course, that uses some theater-based techniques, and I've had a little experience in some of the teaching that I've done, bringing in some theater-based techniques, and it's a very powerful tool to engage physicians and help them process some of the very difficult things. So any comments to add on some of those that I just mentioned? You've already shared with us a number of great programs.
Yeah, the one you mentioned, the theater art program, I think is really fascinating. And I had the opportunity to participate in it before I changed department when I was in the medical education department. And it is truly amazing to see the amount of change that can happen, or the amount of learning that can happen from participants going through these techniques, these theater techniques that you're mentioning. We have had teams that have gone through, and that's not only for physicians, this workshop, we give it to teams, because we are very well aware that, collaboration, interprofessional collaboration is so important to the delivery of healthcare. And we've seen huge changes after teams have come to this workshop, with the hospitals even reporting a decrease in never events after their teams go through this workshop. So definitely one that I think is worth highlighting.
You've already spoken about how you listen to your constituents carefully to help respond in a way that you provide the right kind of support in the right way to the right people. So it to me brings in mind, a philosophical or pedagogical approach that really informs how you develop programs. Do you think about this consciously, or is it just kind of a natural thing? Do you think about what it is how you're going to approach a problem of providing support for issue X, Y, or Z?
Well, absolutely. And I think now you're talking to the researcher in me. Right? When I approach the problem, I need to have the problem that is well defined and the evaluation plan that is there right from the beginning so that we can respond to problems as they arise and modify and get the input from our members. So everything we do, we get input from our members before, but also during, so that we can make sure that we respond to their needs in real time. We talked about one of the priority for the CMPA, which was to adapt to our members in a rapidly changing environment. Well, if we want to be able to adapt, we need to be able to listen in real time and adapt and incorporate the feedback that we get.
Is there something you'd like to be doing that you're not currently doing that you think would really further your work, further your mission, and also excite you, something you really want to do?
I have to say right now, we're still in the growth part of our department. So a lot of the things I wanted to do, we are in the midst of doing them. So I guess the answer I would have for you is, at this point, I'm excited to grow the projects that we're doing, the initiatives, the programs, and get the results and continue growing the department further and implementing those solutions. So my 5-year plan is to finish implementing what we're doing right now and expand. So nothing specific at the moment, but once those programs are running and implemented, I'm sure there will be something else.
So we're kind of winding down toward the end of this conversation, Catherine. It's been really great. I'm going to ask you to think about something that I ask most of our guests, and it's really a little bit of a thought experiment. And it's to have you imagine a couple years from now, maybe when that 5-year plan is finished and implemented, maybe 10 years from now, however long from now, and you're facing the following. All this hard work has paid off. Yay. Health professionals are feeling connected. Talked about connection is a big driver for you. They're feeling really competent in managing stigma, shame about, addressing their own personal mental health needs, for example. They're sharing stories. Their work with patients is of high quality because they're feeling much better. They're no longer having the level of burnout that we're having. Now, this may be a very fictitious, imaginary science fiction world that I'm painting, but just if you can put yourself in that world, they're feeling satisfied and they're feeling a lot of meaning in their work. And I'm interested in you to reflect for a moment on about 2 or 3 different things. The first is, what would it be like for you to work in this situation 5, 7, 10, maybe a year from now when this is true? So one, you can comment on, what it would be like for yourself to work in that kind of environment. What do you think the patients we all serve, your communities that you serve in both personal and public health matters, will experience in their healthcare encounters? And finally, if you could think 1 or 2 things that you knew was key to getting there, to getting into this imaginary world, what might those be? It's really just a thought experiment. It can also help us and our listeners really focus in and think about, what are the 1 or 2 things I really think are really important of all the many things that need to be done. So,
Well, I think I'm very privileged to work in a microcosmos where a lot of that is already true. However, if this was true everywhere, well, first I would be over the moon, but I think the healthcare system would be so much healthier. The healthcare system would be healthier because people would be able to get to that compassion, that reason why they went into medicine in the first place. People would be able to access their compassion a lot more easily. People would be able to access their ability to connect with their patients and with their colleagues. And this would create an environment where not only people are happier, but innovations are easier as well. Innovations happen through collaboration, and that's something that would be a lot easier if people were not in a state of fight or flight, if people were at their best. So this would obviously then translate into healthier patients, into patients that are trusting the healthcare system more as well, because it's much easier to trust when you connect with someone. But when you have rushed interactions because you're limited in your time, because you're not well, because of a million reasons, that deep connection that you need to establish that trust. Because really medicine, if you think about it, is something that is deeply, deeply vulnerable, right? We're asking people to open themselves up to us and share their deepest, darkest secrets. And the trust is needed. And it's really hard to build trust when you don't have connection and relationships. So I think in that beautiful world that you painted, we would be able to innovate, collaborate, have healthier patients, and rebuild the trust that a lot of people have lost.
Can you think of maybe one little piece of that needs to happen for us to even move in that direction to get there?
I think we need to give ourselves permission as healthcare providers to recognize and acknowledge the fact that we may not be well and that we need help, and that we can get help from each other and from the appropriate resources, and that it's okay to talk about it. And by talking about it, then we may finally be able to get better, care for ourselves, and get to this point where we can be at our best for our patients.
Very well said, Catherine, and very inspiring. Yeah. So I want to thank you so much for having the courage to have this conversation, to share with us about your work and about your personal history as well as CMPA. And we wish you really the greatest success going forward.
Well, thank you so much. And thanks for having me here. It was wonderful to chat with you.
Thank you very much for listening. We will include a summary of today's podcast and links about Catherine Pound and other references that were discussed in the show notes. I would like to conclude by sharing another practical contemplative exercise to help you flourish. Catherine Pound spoke about a program that uses theater-based techniques in an experiential format with physicians that, as a result of such programs, they've documented show improved risk management. So perhaps right now we could take a moment to simply notice the many roles that we play, much as an actor does in the professional work that we do. And that's not to say that we don't present ourselves authentically. We actually do, quite the contrary. But we do meet every situation with the most appropriate part of this many-faceted nature of ourselves. So taking a moment right now to notice, how are you presenting yourself to yourself in this moment right now? You may ask questions like, what's the physical experience I'm having right now in this moment? What emotional stance am I having? And what intellectual stance? What's the quality of my thoughts? Can I begin to notice this, bring awareness to these stances and choices that we make in moments of all of our various encounters with patients, with staff, with colleagues? What would awareness of this type do to our effectiveness, our sense of meeting the moments to the quality of our interactions? It's something to contemplate from time to time, and perhaps making it a brief but simple habit. I hope you found this podcast and the simple exercise useful to you, and look forward to having you join us for the next episode of Flourishing in Medicine, From Surviving to Thriving. If you'd like to know more about EmPro, please visit www.myempro.com. If you'd like to know more about EmPro's peer support programs, please visit www.myempro.com/peer-support. If you're a physician or a medical student in need of urgent support, please consider calling the Physician Support Line at 1-888-409-0141 or visit www.physiciansupportline.com. The Physician Support Line provides a safe space to discuss immediately life stressors with volunteer psychiatrists, colleagues who are uniquely trained in mental wellness and also have similar shared experiences. For more information about my work, please visit www.mickkrasnermd.com or www.myempro.com. www.mindfulpracticeinmedicine.com. And until next time.